So this was a man who had a heart attack 3 months ago, and now he's feeling depressed. He's also feeling detached and hopeless. He has started avoiding strenuous activities and his favorite bar. This has been happening for 6 weeks, and he is having nightmares of having another attack. He is jumpier than he used to be. And correctly, all of you all have diagnosed this as post-traumatic stress disorder. So, for post-traumatic disorder, I'm going to tell you all that there are four things, like an amazing mnemonic that is there for post-traumatic disorder is HARD, all right, which is HARD. So HARD, H is for hyper arousal. I'm not writing it down here because we finished the whole lecture with me finishing that word. H is hyper arousal, all right. A is avoidance. R is revisiting, and D is distress. If you see these things happening for more than about 1 month, then the patient is having post-traumatic stress disorder. All right. So hyperarousal is that the patient is jumpy, he's jittery, which our patient is, right? He's jumpier. Then avoidance. They want to avoid anything which can take them back to the incident, right? So strenuous activities cause a heart attack. So he's trying to avoid strenuous activities. He's not going to favorite his favorite bar because he wants to stay away from alcohol. He wants to stay away from any reminders of the incident. In case of a rape survivor, she will try to avoid the spot where it happened, the person who did it, any movies about it. So they just don't want to think about it. So second is avoid. R is revisiting. They keep getting thoughts, intrusive thoughts and nightmares of it. They don't want to think about it. They're avoiding it, but they're still getting these intrusive thoughts. All right. So this patient is having nightmares. So he's having revisiting. And D is distress. Distress, like you can see this, anybody comes to a psychiatrist, that person is distressed, all right. This patient is feeling hopeless, he's become detached, he's feeling depressed, so he's obviously distressed. And all of this has been happening for more than 6 years. So it is fulfilling all the criteria of post-traumatic stress disorder. Now, a common misconception is that PTSD only occurs after things like, rape, etc. But no, it happens after any life-threatening event. So a myocardial infarction is also a life-threatening event. So any kind of hospital admission will be a life-threatening event for anybody. So the criteria can vary. So don't be like so hell-bent on your definitions of what a life-threatening event is. All right. If all of these criteria are getting met, then be open-minded about PTSD. When will you diagnose acute stress disorder? Acute stress disorder will be diagnosed if it is between 3 days to 1 month. So, acute stress, when hyperarousal, avoidance, revisiting, and distress, when these things are happening for less than 1 month, then you call it acute stress disorder. All right. To be more specific, it means between 3 days to 1 month of the event, but just for simplification, I'll say less than 1 month. It is acute stress disorder. All right. What is major depressive disorder? We know that. For major depressive disorder, the mnemonic is SIG E caps. SIGECAPS. S is sleep, I is interest, G is guilt, E is loss of energy, C is concentration, A is appetite, P is psychomotor retardation, and S is suicidality. So for depression, in SIG-E caps, if more than 5 are present for more than 2 weeks, it's depression. This patient is not having all of that. This patient is having HARD symptoms for more than 1 month, so he has PTSD. In alcohol withdrawal, alcohol is a depressant. When you take away a depressant, you will have opposite symptoms of arousal, right? So patient will have tachycardia, hypertension, tremors, seizures, etc. This patient is not having alcohol withdrawal. Like, it just makes no sense. He's just avoiding his favorite bar of alcohol. Everything else is meeting symptoms of PTSD. All right. Midlife crisis. Well, midlife crisis, I think MOKSH has given a really nice definition for it. Let me show you. So midlife crisis is a layman's term describing a transition in identity and self-confidence in individuals between 45 to 65 years. Midlife crisis is what happens to, uncles who become 45 years, become like, they reach 45 years of age and then they're like, oh my God, half my life is over and I have still not achieved things that I wanted to. I'm stuck in this job, which I didn't even want to do. And then they just, try to change everything in their life and they don't function very well. They just buy an expensive car, do random things. I'm sure you must have seen this in a lot of movies. Of course, this is not what has happened to this person. He has a heart attack and now he's having PTSD about the heart attack.
Thanks for watching. Please give a thumbs up and subscribe for more.